She is one of the most powerful women in the world, and today Hillary Clinton flexed her diplomatic muscles here in Canada. The U.S. Secretary of State seemed to take the Harper government to task again, this time with strong words about the issue of maternal health. Our senior correspondent, Terry Malevsky, is on this story tonight. Terry.
Well, Peter, G8 foreign ministers' meetings don't usually make news, but Hillary Clinton does. And in just 2 days here, she's ruffled feathers 3 times. First criticizing the guest list for the Arctic summit, then Canada's decision to pull its troops out of Afghanistan, and now taking dead aim at the Harper government over a very sensitive issue, abortion.
I said kind words about the Olympics, but for the hockey games.
Of course, she softened him up first with Olympic jokes, but then she publicly disagreed with Harper on the role of abortion in maternal health. Ever since Harper made women's health his top priority for the G8 summit in June, his government has refused to agree that abortion has any role to play. But when Secretary Clinton heard the question, she smiled.
Do you think that abortion and contraception should be part of this?
The smile faded, and then came the disclaimer.
Well, I'm not going to speak for what Canada decides, but...
Except, of course, that she disagrees with it.
I've worked in this area for many years, and if we're talking about maternal health, you cannot have maternal health without reproductive health. And reproductive health includes contraception and family planning and access to legal, safe abortion.
That flatly contradicts Stephen Harper and his ministers, who don't want abortion in their plan.
I do not think governments should be involved in making these decisions.
Sitting right next to Clinton was Foreign Minister Lawrence Cannon, who said recently family planning had nothing to do with the government's plan. But he was silent as Clinton drove her point home.
If you are concerned about abortion, then women should have access to family planning.